I hope that you have gathered a lot of information, and hopefully with our multidisciplinary team at UC Davis, we can help do some follow-up questions at clinics and things like that, that maybe you didn't get a chance to ask questions today or would like more information on. So today, let's figure out. What I'm talking about today mainly is the psychosocial development in adulthood, transitioning from pediatric into adulthood with Duchenne's, and basically this is a new frontier. There is some research, but not a lot of research about caregiving aspects, the role changes that happens when you transition from pediatric to adulthood, because this is all new frontier for us. And my background actually is in gerontology, which is the study of aging. I'm a social worker, but I also actually was teaching at Sac State before I started with the multidisciplinary team at UC Davis in gerontology. So I have tons of resources for those 60 and older. And so this also is new for me, experience as far as finding resources and having these discussions with our families in clinic about what's going to happen as the child ages into adulthood. And basically our care system has been set up strictly for the aging population 60 and older. And that's unfortunate. But the young adults are aging as well as their parents and caregivers are aging. So you have two dynamics that are happening in the same household. There are role changes. So you have your child becoming a teenager. We've talked a little bit about the puberty and the hormone and with Dr. Sarampudi. And then the changes of your providers changing as well. You're seeing maybe we're seeing Dr. Jawar for your pediatrics in pulmonology, and now he's not seeing them in clinic anymore. So there's changes there. There's changes when the teenager becomes an adult. So for the patients who are on CCS, the California Children's Services, when they turn 21, they're no longer in that program. And so there's a lot of questions about what kind of services can my young adult get now that they are just the Medi-Cal for insurance. So the goal for our team is to focus on maximizing the best possible outcomes for aging in place and becoming independent if the patient chooses to do that. Some of the key areas that I think is the most important in our clinic is discussing advanced healthcare directives. When a person turns 18 years old, they have the power to make their own medical decisions. That is how the law is. They can designate a healthcare proxy, which they should. Anyone over the age of 18 should have an advanced healthcare directive. Those are the documentations that are put in place for you to have in case you cannot speak for yourself, if you're in extenuating circumstances. You could be in a car accident and not be able to speak for yourself, and what would you want your outcomes or your plan of care to be? But particularly for our patients, advanced healthcare directives guides the parents also in helping their adult child navigate the healthcare system as well. For instance, the patient at 18 can request to see the providers alone without their parents. That is their right to do that. Is it always the best decision? Well, we have to determine that in clinic if the person is able to process a good plan of care and strategies for taking care of themselves. But they can do that. They can designate that at 18. They also, parents will have oftentimes difficulty talking to insurance companies about their child's welfare, the adult's welfare, because when they turn 18, insurance companies don't want to talk to the parent. They want to talk to the adult. So we have to help educate parents on getting getting healthcare proxies in place so that their child can have support through this whole process. Limited conservatorship. So we haven't talked much today about regional center support, because typically that is, they focus on folks who have a developmental delay in addition to the neuromuscular disease diagnosis as well. But the ALTA in Sacramento area, ALTA Regional Center, can help with limited conservatorship for developmental delay when a child turns 18. Conservatorship in California is very challenging and very difficult process. So having those advanced healthcare directives in place will help a lot, and again, will help you as the parent continue to advocate for the young adult. There's also options for living wills and trust, designating who will handle the care of your young adult if something should happen to you or your spouse or partner. And so having something designated for that, estate planning as well. And one thing I didn't include on here is if your young adult is on SSI, there's a savings account. In California, it's called CalAble. And you are allowed to put money into this account. It's a savings account that does not affect their eligibility for SSI. And so that money could be used for caregiving, could be used for independent living resources. It's not a well-known, there's not a lot of people that know about this program, and I'm not really sure why. But it's a very key piece to keeping people with SSI, giving them a little bit more income. And with quality of life, we're trying to find meaningful spiritual connections in the young adult's life. What are their passions? What are the things that they're interested in doing? And then keeping the social engagement, which we'll talk about next. But basically, I want to stop for a second, and we've heard today a lot of the medical interventions that have been it's been a wonderful and refreshing thing to hear today, and I see it in clinic as well, is that these medical interventions are leading to longer lifespans. We're seeing patients in our DMD clinic 30 to 33 years old, and this is fabulous, and it's a wonderful thing. I think we are missing the conversation about how successful these young adults are is the parents and the guardians and the people that are taking care of them in this later part of life. If it wasn't for that unique nucleus of family and community support, we might not be seeing all these great outcomes. So, to the caregivers, you're the key piece to keeping longevity going. But as a social worker, we do a lot of theories. And person and environment theory really states that there's a nucleus, and I think Dr. Henriksen touched on this as well. There are so many pieces to the pie when it comes to caregiving, and tapping into those resources is sometimes there's things out there that families haven't even thought about. So when I'm doing I do pediatric psychosocial assessments as well as adult psychosocial assessments. But there's just listening to what they say that they're doing and commending them for the good things they do, but then picking out little things that I hear. Often people will say, I go to church, and I've talked to someone at church that that's actually an IHSS provider, and I'm actually may be able to hire them. So encouraging them to talk and network in the community is so important, because that's where a lot of resources can come from as well. And word of mouth. I was sitting at lunch today at a table with families and listening to them share resources. You don't know what you need until you need it. So who do you ask? We have a lot of resources and a lot of websites and a lot of information which can bog you down. And so this is where the multidisciplinary team can help you navigate the system and find out what you're eligible for, what you might qualify for, what is free, and what might be appropriate for you. So that's our theory. Did I skip one? I skipped one. Yeah. Okay, role of social services in multidisciplinary teams. So I'm the social worker for all of physical med and rehabilitation. So I cover the gamut of from Duchenne Muscular Dystrophy Clinic to our ALS clinic, to neuromuscular disease clinics, spinal cord injury, amputee. Every day is a different day, which is great. But really what we're trying to do with patients is assess the psychosocial health and well-being of a person and how they are managing things in their environment. I focus on individual education plans and helping parents start that process and have that communication with their schools, and the 504 plan as well. The MDA has a great resource, I brought it up here with me, on the table today about your IEPs and your 504 plans. We write letters in support of both, and not all DMD patients actually may qualify for an IEP, but they definitely would qualify for a 504. And once these plans are in place, starting in kindergarten, you can start this in kindergarten, this will follow them throughout their career, their high school, into college, and into the workforce, which I'll talk a little bit about as we go down the line here. I'm also have the capability of doing assessments for depression and generalized anxiety disorders. But mainly my focus in clinic is finding resources for respite counseling, community support, transportation, helping navigate the insurance rules and regulations and what's available out there to help support you. Again, with the goal of keeping the individual in the home successfully for as long as possible. I am a big proponent of social engagement. I'm a very big social butterfly, but I see also in our aging population that there's a lot of isolation. And our young adults tend to stay home more, play more video games, which is fine. But it's also important to get out and mingle. And one of the things that we support definitely is our wheelchair soccer teams. Encouraging that. I've been to some of the games and watched that happen. It's really exciting. There's a lot of recreational activities here in the state of California, and particularly this area. There's adaptive sports. There's the well at Sac State, which you don't have to be a student of Sac State to attend. They have adaptive basketball. So there's just a lot of opportunities. We just have to find the right and appropriate one for each of our patients. College. So I'm having the conversations with the 17, 18-year-olds in clinic about what would you like to do once you graduate from high school. And online colleges, online programs, trying to stimulate them into finding something they're interested in studying. It doesn't mean that they have to go to a 4-year school or even a junior college. There's plenty of things online that they can engage in and have blogs and conversations with online classes as well, which does increase the socialization even though they may be homebound. And each of our junior colleges and our 4-year colleges here in the state of California do have ADA departments on their campuses to help students navigate the system and give them assistance with either someone to take notes or to help them with testing, but really to help them through their 4 years of college as well. Employment, so going back to the IEP and the 504 plans, the Department of Rehabilitation here in California has job training skills programs. They help with resume writing, but the main important thing they have related to employment is that they partner with community organizations and companies, and they are the advocate and the support person for that young adult who is applying for a job. And they will help them get connected to jobs. They have a job listing website. And so they help with a multitude of things, but one of the main things, if someone does want to work out in the world and make money, they will assist in that as well and follow them throughout their career. The other social engagement program is for those with developmental delay. in the adult day programs are through the regional center services. So United Cerebral Palsy has 2 or 3 adult day programs in Sacramento County that will, you can take them there, and it's like a day program where they can enjoy activities and games and socializing with others. Again, this is with the component of developmental delay is a requirement of that. And one of the areas that is we haven't really tapped into, and I cannot find a lot of research yet on this, is dating and intimacy. And so I've had a few conversations with our older adult young men about dating and the fear of building a relationship only to be heartbroken and realize that this is not exactly what they thought it was going to be. It's not what happened in the movies, and that they have isolated themselves to the point that communication is very difficult. And so that is a really hard discussion to have sometimes about their feelings about sexuality, about intimacy, and touch is so important in all adults. As a young child, we are holding hands and we're holding them and hugging them, and as an adult, the adult child kind of pushes the parent away. So there's a gap there of intimacy that's missing. And so we need to focus more as professionals in the field on how we can encourage more of the intimate relationships. It doesn't have to be all about sexuality and sex. It just a matter of touch and a love. So caregiving support into adulthood, these are our challenges that we're seeing here. Although California, I think, has got some really good programs, and we're very fortunate to live in a state that does provide some of these in-home support systems. They've realized over the years that it is a lot less expensive to keep folks in the home, no matter the age, rather than institutionalized in facilities. So they have put some plans in place that sometimes work and sometimes don't work, but in-home support system is a state program in California. There are many states that do have an IHSS program. I don't think all 50 do, but you have to qualify for Medi-Cal in California, and the provider is paid by the state to support activities of daily living. So you sign up for IHSS, you have a social worker come out to do an assessment on the home and the abilities and capabilities of the person to determine what they can and cannot do. And they're focused on all the activities of daily living. And then your hours are scored by what the person can do for themselves and what they cannot do for themselves. The maximum per month for IHSS hours is 283 hours. And those are typically what's called protective supervision hours. And that is a situation where the person is not safe being alone by themselves, and they have to have constant supervision. And it's kind of rare to get protective supervision, but you can get a lot of hours that way. The provider is background check, fingerprinted, and hired by the state. You can interview different providers, and the good news is the caregiver can be paid themselves. So it's good to supplement an income if you've stopped working to take care of your child or a young adult, that this would supplement maybe a little bit of your income. Then there's the Home Community-Based Alternatives Waiver Program. This is a federal and a state program. Again, eligibility is Medi-Cal. And the goal is to, again, those that are at risk of nursing home or institutionalization placement, this is to keep them at home. And they have to meet medical requirements for this. So you get a team, you get a nurse, an RN, and a social worker that will do the assessment, and it's more case management based. But you can get additional hours on top of the IHSS. So you're not giving up your IHSS, you're tapping into this other waiver program. There has been a little difficulty getting into the HCBA program because there was like a 2-year wait list. But things are moving. The state has kind of backed off and now handed it off to home health care agencies. And so it's speeded up the process of getting people into the program. The other one that I've talked to a couple of our families about is the Assisted Living Waiver Program. This is a California program. There's 15 counties that participate. There's 38 facilities in Sacramento County, and these are boarding care homes or assisted living facilities. This is Medi-Cal and SSI, so it does take a big portion of SSI to supplement what Medi-Cal will contribute to the care. But this is a person moves into assisted living facility. They have to be 21 or older, and right now there's a 2-year waiting list because there's just not enough counties participating. You don't have to live in Sacramento County. You can agree that the person will live in Sacramento County, or one of the other 15 California counties that participate. There are medical limitations to a boarding care. So boarding cares are smaller homes, 4 to 6 residents, but generally they're for the aging population. So your population in these homes are 60 and older. And so this, again, might not be the appropriate placement for a young adult who is cognitively aware and very active versus someone who has dementia, being in a home with people with dementia. Assisted living facilities are great because the person would have their own apartment-like environment, but they're also in an apartment-like environment. So you still have to supplement some of the care with IHSS to have someone there to help them at certain times of the day and night. So these are just a few of the programs that seem to be on the forefront of recognizing the importance of our aging Duchenne population. When I talk to geriatric care managers, they know that this is an issue, and they are advocating for more resources to provide assistance so that we can give our patients a good quality of life as well as some independence. And one of the areas that I don't have on here specifically is the Department of Rehabilitation does have an independent living program. This program is based off of, obviously, Medi-Cal and SSI. So if you're living independently with SSI, you get a raise. So you might get up to $900 a month, where if you're living at home with your parents or family members or caregivers, it's about $650 to $700 a month. So you do get a raise with independent living, but you're in an apartment setting. So you're in an apartment complex. They are for low-income older adults, but they do have the ADA amenities that is required to live that environment. But you would need IHSS and both the home community-based waivers to help with the care. And so there's a fear of that falling apart because it puts the young adult into I'm making decisions for myself now. How is that going to work? But it also gives them the freedom of living independently as well. They do have a case manager. The Department of Rehabilitation monitors that and makes sure that they're safe and that they're well cared for as well. So, and the families, of course, can be involved, which is one of the most important things, keeping family involved. So some of the interventions that we try to troubleshoot in our clinics as far as social services go is using your multidisciplinary team resources, the CCS medical therapy unit school-based programs for up until they're 21 years old, continuing with the physical therapy monitoring and other equipment needs. The regional center, if they qualify, state Medi-Cal and in-home support services. We can put referrals in for psychiatric and psychological support in our clinics. And then tapping into family, your fictive kin support, which is your neighbors, your friends, people who have supported you through this path and what you can do to include them in the care plan. And then your community support, your schools, your churches, getting legal advice and legal support for planning for the future. And I think I just included some additional resources for the adaptive sports, the assisted living, disabilities, and home community-based waiver program. And that's it.
we will open it up if anybody has questions. Yay. Oh,
Hi, I didn't know you existed. And how would a family reach out to you from the MDA clinic?
So I usually do, I'm there at clinic on Wednesdays. If sometimes I'm in almost every patient's room, and so I miss patients. I don't get a chance to talk to them, but I can give you my card before you leave today. You can call me directly. I have a confidential direct line and email address.
Okay, thank you.
You're welcome.
Thanks, Lisa.
Yeah.
I want to just say that we're very excited to have Lisa on board as a part of the team. And, I think one of the things, and this is a completely new area, having adults in the community with DMD. And there is learning about how to kind of optimize that experience is first and foremost one of the most important things that we need to understand about transition from childhood, teen to adulthood in people with DMD. There is actually a growing community nationwide of guys with DMD who are managing their own care and who are starting things like Facebook discussion boards and peer groups, and who will get together and meet at the MDA national meeting or have teleconferences or get together at PPMD and share stories, resources, recommendations for how to do things like select and hire your own caregivers or manage the schedule for a group of assistants who help you throughout the day, throughout the week when you're in college. So I think there are a lot of resources that we commonly hear about that are more in the range of assisted care and things like that. But there are the expertise in the community from adults with DMD themselves right now is growing and is pretty remarkable. So and now those guys are starting to bring these discussion forums down into even the early teen years, because one of the things that I think they've recognized is that they're not, many of them were not necessarily prepared for. And when I say prepared, I say sort of prepared by family, community, society, whomever, for adult roles. And so they felt like they've had to kind of scramble to keep up or scramble to learn some of these things. And now many of them are feeling like they are now trying to impart some of that information and some of that learning to the younger generation while they're in sort of a normative part of the lifespan where you're learning to become independent from your parents, you're learning to take some chances, make some decisions on your own, things like that. And it's really remarkable to hear these guys talk about learning to become independent as teenagers so that when they get to that adult transition, they're not just thrown into adult care, which frankly, we haven't done a very good job of for the last forever. And we're learning as well. So, for those of you who are wherever, if you're an older guy with DMD, if you are a parent of a teen, if you're a parent of a young child, know that these resources are out there as well. And this is something that's brand new and still developing. So, it's not a one-size-fits-all kind of proposition, and everything is tailored to the needs and the abilities of the individual. And for those who are, on the higher level of individual function, there's some guys I know with DMD who are frankly more functional than I am on a cognitive level. And so, I think it's pretty amazing, and just be aware that those resources are out there. We can figure out ways to hook you up with those resources if you want.
So actually, just as a following up on that comment, I'd just give a shout out to there's a John Kerr Foundation, which runs for young adults sort of this issue of how do you prepare for independent life. It's actually based just outside of Yosemite, fairly close by here. It's worthwhile to do. Your sons can't do that, or your daughters can't do it until they're 18, I believe. But sort of 18, and you can't do it after your 23rd birthday, and you can only do it once, and it's typically a small group for 4 or 5 days. And it was worthwhile for Dylan. I would just
Good.
comment, and I'd give a shout out to that.
Good, no, thank you.
And you can find them on the web. Just search for John Kerr Foundation. So it's a resource for all of us. But the other thing I'd like to pick your brain about, because I think there are inadequate resources for allowing our young men, what they're facing, to live independently. And you described some of them. So a lot of the home sort of small group-based living is really inappropriately set up
Right.
for young adults. We simply haven't created it.
Nope.
There's living facilities that are set up for those with intellectual disabilities that are built around that, but we've failed to sort of create that housing situation that'd be appropriate for substantial medical challenges, but cognitively
Right.
alert, wanting activities, and sort of grouping them in a way that would work. I mean, is there any state initiative? I think about it as, if I were a developer, I would start developing small units that would work well, because I think it's just inevitable that we need it,
Yeah.
and it's an opportunity. But is there kind of a vision for how that would work? You're probably much more plugged into that.
So I have a huge vision for that, but I think where the challenges are is finances. So for the older adult population, 65 and older, there's more resources and there's more income, and the boarding care homes for them can be anywhere from $4,000 to $5,000 a month for care. For our young adults coming into the system, they're on SSI at $685 a month. So money definitely plays a huge role in that as well. And then the caregiving situation, someone with dementia doesn't always need a lot of medical interventions, but our young adults may need a lot more medical interventions. And so you would have to have an RN, available for care, in a boarding care. Under Title 22, there are some boarding cares that are owned by RNs, and those are the ones I've been trying to kind of focus on when I'm talking to them, is about, do they have the capability, one, of taking care of someone with non-invasive breathing equipment? Do they have the capacity to do that as well? Because they have certain rules they have to meet with Title 22 regulations, and those people residing in those facilities actually have to be able to take medications themselves. So if the person isn't able to take the medications themselves, they don't qualify. So there's a lot of challenges in that because of that situation. And I think you're going to see more and more conversations, obviously, about this, because we're going to have them based on all the medical evidence that we're seeing. The quality of life is so important. And but also, too, the other dynamic there is that the families have been caring for these young adults their whole lives. And that separation of allowing, if you have a normal 18-year-old, you're ready to go to college. Send them off to college. I'm changing their room into, my sewing room or whatever. But if you've been caring for a child all your life with this diagnosis, and to have the thought that they want to go and move into a place by themselves, it's very startling and very traumatic for some. And so even having the conversation, and I'm going to use Janet back there as my example, we've had this conversation multiple times. And it's the fear of what would happen if my son did go and live by himself, and he had all these different people coming in all hours of the night, and I don't have control over that. So there's that dynamic as well. So it's going to be a challenge, but I hope that we keep this conversation going. We have to keep the conversation going. We have to knock on the doors at the Capitol and say, this is what is needed. But again, for decades, the money that is going into respite care and programs is generally designated for 60 and older. Yes, Janet.
I was going to say, too, there's another program, or it's a camp at the same place where they do the Kerr Foundation. It's called Justin Woods Foundation. And what it is it's a family who had a young man who had Duchenne muscular dystrophy, and he passed away, I think it was like, I don't know, 4 or 5 years ago, but his family started a camp because he wanted something to do beyond muscular dystrophy camp. And so they still do that. You can look that up too. It's called the Justin Woods Foundation. And they do a camp for adults with
Yes,
muscular
and they have
dystrophy.
focus groups and discussions about, living independently and skills.
And just on that note, the Justin Woods Foundation is an adult camp based on the MDA Camp. As they were talking about that fear of somebody else, either the individual has a fear of somebody else providing care for them, or it's the parent or the caregiver that has that fear. If you have a younger child, 8 to 17, this is my plug for MDA Camp. As much fun as it is and all the great things that we do, one of the wonderful things that MDA Camp does is it teaches independence, and it shows these kids that they have other resources out there, and that it's okay if it's not mom or grandma or your brother providing care, that you really can lean on other people.
I'd like to put one more plug in. This is actually an MDA alum. I think especially this fire season in California and with rolling blackouts and the different infrastructure challenges that we're having right now, one of the things that is important and the state's starting to recognize is the Office of Emergency Preparedness in California now has a special division for individuals with disabilities and for preparation and really looking at emergency preparation for individuals with mobility disorders, special medical needs, things like that. It's headed up. The state director is Vance Taylor. And Vance is a gentleman who has a severe Becker muscular dystrophy. He and his family moved here from Washington, D.C., and where he and I worked at a camp together. He is out here now really trying to advocate for emergency preparedness, specifically activities specifically associated and directed towards both mobility limited populations and others with special medical needs. It's a program that's worth looking into and talking about more, and just be aware that the state is trying to organize more services around those areas. And I think it's a great start, and has a lot more development work to do.
Actually, I have a related comment, which is we have a family that lives, I think, in the Fairfield Valley, who was in the area that was having blackouts, and PG&E has a program where you can apply and get funding for certainly backup batteries and things like that for wheelchairs. And I think, at least I put this in my very strongly worded letter, that this family needed help with a backup generator. So PG&E specifically has funding for that. I don't know the name of the program, but if you Google it, I know, and we're lucky enough, most of us up in this area, to not be impacted, but I know a lot of families that come to our clinics are in areas where PG&E is doing blackouts. And my understanding is a lot of the batteries that come with wheelchair and BiPAP and all that are really only good for like 24 hours. They're not intended to be long-term batteries. So.
Hi, thank you for all this information. I come from the Reno Sparks area in Nevada. When will you have a symposium like this in the area for patients with neuromuscular diseases
I think that'd be a question.
in the future?
Yeah.
So we are making our plans for our 2020 Engage series. Our goal is to reach as many areas of the U.S. as possible. Seeing as how our MBA offices are somewhat limited in our territories, we're hoping that across the next couple of years we will be able to reach out to some of those communities where there's not an MBA office, but we know that there's a need for events like this and care centers and outreach to the community. Unfortunately, I don't have a date or a year that I can give you,
And I would encourage folks to, these in-person are wonderful, and we will be continuing this, as Peyton had said, in a 2020 series and onward, but we're also doing more community-based webinars as well to be online, so that we can continue to reach more and more families as well. So encourage everyone to kind of favorite or bookmark on the MDA.org site, the MDA Engage area, because we will be updating that before 2020 with plans for 2020.
We're going to take one more quick question here, because I know we're running a little over, but I want to make sure we get to it.
I just wanted to ask about those of us who have children that are the mentally delayed and transitioning into age 18. Is there more information about conservatorship? As you had said, it was very difficult to get. Is there
Yes.
resources available to help us facilitate that?
Yes, if you're connected to a regional center, or have you, is the primary diagnosis?
Yeah, we have
Okay.
Alta Regional who said they would assist in that, but is there other
You can go
resources that are available?
You can go through the probate courts to do, a limited conservatorship. I always kind of direct people to legal services in our area that help navigate that. Again, it's a very challenging. Probate court, though, is a lot of documentation that you have to bring, and two doctors and a psychiatrist to deem the person cannot make decisions competently for themselves. So there's quite a process to go through, and that's why if Alta can help you start that process, that would be the easiest route to take. But you can do it on your own. It just is a longer process, and Alta kind of gives you the guidelines and the forms and helps you navigate the system, the legal system with that, which that's a great program. So, yeah. Thank you.